$1 billion is taken away, and the result is Mayo Clinic will not take Medicare insurance. We need to do better than that. I believe that we should stand with the seniors, which is why that competitive prescription drug purchasing pool mechanism was used as the basis and the rationale for how we got senior care in this state. It was an idea that was led by a lot of different groups and associations trying to find how to reduce costs, lower costs, and provide access to quality health care. That's an issue that I'll continue to work on, listen. I'm not going to stand and have all the answers because the answers came from folks like you. When I open those hearings up across the state of Wisconsin, I'm going to do just that in Washington. I'm going to make sure that I'm listening, I'm defining the problem, and I'm putting together policy decisions that work based on sound economics and free market principles. Thank you.
I allowed you to be king for a day a little while ago. Let's try this again. Because I think this is really a critical subject. Back in the old days, certificates of needs were there. And before they could build a new hospital, a certificate of need had to be requested. The hospital rate review was there. Republicans have had reign prior to the Obama administration, and they didn't do really anything about health care except we'll give you a tax break for your premiums, or we'll give you tax breaks for maybe your co-pays. I'm looking for something of substance that people can take from this meeting today, and particularly with these seniors up here, because those on Medicare, now I recently qualified, now I'm in that category. But it's a very interesting time because clearly Medicare could be in the sights of this health care bill, and there's no easy way out, so I'm not looking for an easy answer from either of you, but let's just take that a little deeper.
Sure. By the way, I hope I look as good as you do when I get to be that age. That's a compliment. I can say that because we're friends. But I will tell you, this is a very complicated issue because part of the reason that you have to address health care costs is because of Medicare. I mean, you want to talk about the biggest problem facing the U.S. economy. It's Medicare spend. It's the biggest problem. And in fact, the unfunded liability in Medicare is $74 trillion. Now, the total net worth of the entire American population, their homes, businesses, and real estate is $72 trillion. It's a net asset value. So, the promises that have been expressed to the American people are greater than the total net worth of the American people. So we know that those numbers don't work. They just don't work, and so reform has to happen. And that's why it's so important for reform to actually occur, and reform that actually drives costs down. Because if you can drive the overall costs down, then the cost to the Medicare program goes down. Now, I would propose to President Obama that, because I remember very clearly when he first started talking about health care reform, and he said there's $500 billion of waste in Medicare. Well, I would propose that he goes and gets it. That might be a first good start. Let's go root out the fraud and waste of this whole thing. Regarding the Republicans having control for 6 years of the last 10, and I really look at the Congress as far as control, I completely agree with you, Ron. Government has ignored this problem for a very, very long time, and governments have a tendency to do it. I find it a bit disingenuous when I hear state legislators talk about opening up the ability to buy insurance across state lines. That's a state regulation that's costed. Where were you when you were there? And why didn't you propose fixing it when you were there? You know, and these are the types of fixes that you don't just talk about in political campaigns, but you execute. And you have to begin to get that down. But the real solution is to get Americans to live healthier lives and then to measure outcomes against it. And that's why I'm so convinced that we have to begin to move consumers closer to all those decisions. Just not just their health insurance decision, but their physicians and the whole way they live their lives. For example, if I have a group of 50 workers in my company and 5 of them smoke, the cost of those smokers, the additional health risks that they bear, gets shifted to the other 45. And they don't see it. There's no direct impact on their actual costs. By having them responsible for it, they will immediately see it and begin to make lifestyle changes that would result in a healthier American. And as we have healthier Americans, the costs will go down. Secondly, we ought to be incentivizing more physicians and more young people to go into medicine. We need to shove supply up dramatically in this country. And if we can, and we need to begin to remove the roadblocks that stop young people from wanting to go into medicine. We need to encourage more people to go into medicine. I mean, listen, by the way, if you have college-age kids, you might encourage them to do that. It's one place that they'll for sure find a job. And so we need to do those types of things, along with some of the other things we talked about, to truly get the costs down. But the fastest way to get costs down, quite frankly, is to have Americans healthier. That will drive and bend that cost curve down dramatically, because it's dollars in and dollars out, and that's just the reality of it.
Terry, before we move on, do you want to take a little kick at this Medicare concern and what maybe the Republicans have or have not done, and what
Okay.
maybe do through regulation?
Okay. Well, I don't have broad enough shoulders to take responsibility for people that couldn't get things done. But I'll just talk about what I did, because I think that's fair enough and that's what you want to know. In putting together the mechanism for competitive prescription drugs, we created the entire mechanism for senior care. I think that was pretty outstanding. Most people understand that. It took a lot of hard work and policy minds and economics knowledge to do that. You know, when you're in public office and you want to serve people, you need to have the ability to build coalitions and have a grasp of economics and what is right, and putting people first in order to understand how to move the ball forward when you're in public office. Now, that's something I have a track record of doing. Now, when I work with the National Federation of Independent Business, and I work with the WAPU, and I see there's a member that's in the room as well, we took on that battle on trying to have state lines, you know, to cross state lines in order to purchase health insurance. It didn't get passed. We also couldn't have a tax credit for, you know, your funds that you would choose to decide, your savings accounts. You know, there's a lot of things that can do, but I think pointing the finger gets us one place. 3 fingers pointing back at us because we haven't done enough. Now, to secure Medicare, the number one, and I guess I know a little bit about physicians. My oldest daughter's a physician. She's in her 2nd year of residency. And I can tell you it's very competitive. A lot of individuals want to become doctors, but they don't have the moxie and the intellectual firepower to get there. We have a lot of doctors. The problem is there are no competitive grants, there are no competitive opportunities, so most physicians come out of medical school with about $250,000 worth of debt. So you're starting your practice there. If we want to reduce costs in healthcare, maybe we should have competitive grants for those physicians when they're smart enough and have earned their right for a spot at a medical school. There's a thought. Defensive medicine costs us a lot of money, and it's because physicians are worried about being sued. So they order every procedure that they could possibly order to make sure that they've covered every base so that they don't have a liability on their neck, which is why I mentioned that we need tort reform with those frivolous lawsuits. You know, whenever you use political answers or short quips to solve problems, you never get the policy result. It takes long-studied research and hard work. It takes skill sets, some experience in how do you get down to the bottom of the problem, and it needs an individual that knows how to work with others and build coalitions to get things done. I mean, you know, we could fire it's your fault all day long. I'm never going to do that because the buck will always stop with me. If I don't know the answers, I'm going to find the best experts in the private sector to bring them to the table in order to come up with a policy decision that serves the people. And I think that's what you want. I think we've had enough of finger pointing and mudslinging in politics. I think it's time to elect people that actually have the ideas and have the entrepreneurial spirit to come up with the solutions that this country needs. Thank you.
Thanks, Terry. You want to stay right up here?
Sure.
Immigration.
ask questions on the Medicare?
We'll take one question on Medicare. Then be very concise in your question, so we give it.
You're both talking about repealing Medicare, and I on Medicare, as you can see, right here. And
Not talking
my
about
wife
repealing
is
it.
just going on Medicare this month, and her Social Security was $811 a month. Out of that, $110 is going to go towards Medicare. I pay $110 towards Medicare. Every great person in here pays $110.
Question. We need a question.
The question is, why do you want to repeal it? My wife can get mammograms now on her Medicare.
I will tell you this. I did not hear repeal in any of their comments. That's something you heard.
No.
I did not hear repeal under any of the responses, just so you know that. I want to be very clear on that. That was not under. What you did hear is that through the healthcare reform, healthcare reform,
It's tied to Medicare.
these people did not purport that. We're going to move on to immigration because I want to make sure you understand that because I deal in that area quite
I've been doing it my whole life.
Okay.
But here is the thing from the government.
Sir,
Medicare and new health
we're
care
going to move on now. We're going to move on to immigration.
But, okay.
Immigration. Somewhere between, how many? You pick a number, 10 and 15 or 16 illegal immigrants are supposedly in our country. What are we going to do collectively to rectify, to fix it, to make them legal? What would you do? Again, I'm making you king and queen for a day. Because you're one of one here today. Or one of two as the case may be. When you get to Washington, you're one of 435 or one of 535. If you could do something, what am I going to do today? So I'm going to ask you even tougher questions after this. But I mean, it's critical. These people know where you stand.
Sir, I just want to honor your question. I wasn't, I'll speak for myself, talking about repealing Medicare. I was talking about the other piece. I support and will make sure that eligibility doesn't increase either to Social Security eligibility. So I just wanted to clear that up.
Jerry, if I could just say, I give the facilitator a letter about healthcare reform.
That'd be fine.
I was in the paper for my son, who's a small businessman who has Crohn's, and he cannot get it, he cannot go to work because of pre-existing illnesses. And read this letter, and I'm asking the politicians, why do you want to repeal healthcare when he can finally get health insurance and go to work? He's got 4 kids. I mean, I just want to know why.
I believe,
Letter, and I don't need an answer now, but read
right, I believe I'll look at the letter and I do want to hear your concerns. I just want you to know I'm not shutting you out or ignoring you. I value your question. In terms of immigration, I'm a constitutional conservative. I'm a constitutional Republican, which means I want to follow the law. Illegal immigration is, are people crossing the borders without going through the process of becoming citizens. I fully support patriotic immigration and patriotic, valuing of becoming a full citizen in this country. Most of us can trace back our roots for how we became Americans. That's how this country was built. Unfortunately, we're at a time where we've had so many political solutions instead of the rule of law, instead of the Constitution take precedence, that we're in a crisis with that too. We have a back door in this country that leaks so much like a sieve that the recent arrests of individuals that came over into our back door were from 9 different countries. Some of them from the Middle East, some of them from Eastern Europe, some of them from Mexico. We're seeing 72 at a time mass graves.